Hi everyone, welcome to this week's episodes on Eat, Live and Be Well. This week we're going to focus on back pain, the most common presentation to medical clinics all over the world. My name is Dr. Dennis Nturibi and this is Eat, Live and Be Well. Now, what causes back pain? And why is it that some people seem more affected than others? That's not a simple question to answer, primarily because there are multiple causes of back pain. Now I'm going to focus on one or two of the main ones. As cliche as this may sound, we're all getting generally weaker. And this is because we spend a lot of time seated down. So our muscles don't get the physical activity they are meant to get on a day-to-day basis. Now that is not a problem if all you do is stay seated, okay? However, life is not like that. In fact, if you stay seated all the time, you'd end up being completely useless. Once in a while, you do have to do something. You have to pick up a suitcase, you have to pick up a child, you have to clean the house, and that's when the back pain kicks in. Commonly for a lot of people, when they bend to pick, okay? So if your muscles are not as strong as they should be, you might find that picking up 10 kilos, a 10 kilo load or a 10 kilo child might be strenuous. Whereas with your body, but now if your body was at the level of fitness, that a reasonable level of fitness, you might find that it would get to 25 kilos before the load becomes strenuous. Therefore, at 10 kilos you're straining, which means at 15 kilos you're probably going to get hurt. The reverse is also true. If you are strong and fit, you find that you are comfortably lifting 25 kilos, but one day you might try and lift 50 kilos and still get hurt, right? So there's a component we call proper lifting technique, and we're going to discuss that in the next video where we'll actually demonstrate what is proper lifting technique to avoid back injury. So in terms of sort of finding a solution to this problem, most of us need to get physically active. We need to be physically more adapted to the roles of normal living than we are today. Things like cleaning the car, cleaning the house, cleaning the dishes, washing clothes, okay? How come your nanny at home can bend for 2 hours washing clothes for the whole family, but when you try and do it for 30 minutes, you have that back pain that leaves you feeling like you need some big giant to come and open you up and stretch you out. But that is actually not normal. From a medical perspective, what actually happens is that you strain your muscle. It's a muscle strain. The same way a soccer player might go to kick the ball and pull his hamstring, okay? Is that you now strain your muscle of the back. Traditionally, we don't strain these muscles because your back muscles are some of the strongest muscles in your body. And they are very strong because your back muscles are involved in keeping a human being erect or upright. We spend most of our day in an upright position, okay? And your muscles have to work on a constant basis to keep our bodies upright, and that is why they're strong. However, again, like I'm saying, because of our common lifestyles, you find that we're getting weaker and weaker and we're not able to handle what we should comfortably be able to handle. You then pull the muscle and tear it, okay? We call that a muscle tear. What can also be causing your back pain is a tendon strain. So the same way you can strain your tendon of the ankle joint, you can also strain one of your back tendons. Now, another medical condition that commonly causes a syndrome of back pain is what we call disc prolapse. And a lot of people might define this as that moment you go to pick something heavy and you start coming up and something snaps in your back and you're stuck there. You can't even come up because you now can't move, and it takes minutes or hours to finally get to an upright position. So that kind of sudden onset sharp back pain associated with heavy lifting is possible to be due to a disc prolapse. What is a disc prolapse? Your muscle, your vertebral column is arranged as in this manner. You have the vertebral bodies that sit on top of each other, and these form your spinal column. And between them, you can't have bone sitting on bone, otherwise there'll be a lot of discomfort and friction. So there's a cushion. There's almost like a soft cushion which plays the role of cushioning between the two bones. And this soft cushion is made of a certain fibrous material. And the inside of the soft cushion has some gel. Okay. Now, because of, remember in our previous video we talked about degeneration of the bones. The same way, even the cushion between the bones of the spinal cord degenerates and becomes hard, because this cushion is a soft cushion. When it becomes hard, what happens is one time when you're bending, and because the cushion is now hard, it's not stretching and soft the way it's supposed to be, when you're bending it strains and then it cracks, and the fluid, the gel at the center which acts as a cushion, seeps out. Okay, and that's what we say the disc has prolapsed. It's not a disc the way we think of a circular disc which comes out of it. It's actually a tear in the disc complex, and part of the central core, soft part of the disc, protrudes out, and that causes acute pain. And with time, it's going to press the nerves, because at every disc there is a nerve coming out, and with time this can actually go and compress the nerve and cause another kind of pain, which is due to nerve pain. So disc prolapse can happen even in young people. They happen also in athletes as part of trauma, but again we're also seeing them commonly now as part of early degenerative changes. From a lifestyle perspective, I think for all of us, the fitter we are, the more physically active we are. When we eat foods that promote building of the body and healing, then of course we avoid, or we can delay as long as reasonable, the onset of a lot of these lifestyle conditions. So back pain does not have to be your lot in life. If you do have back pain, please see your medical doctor or your family physician, who is going to work with you to find the best solution to your back pain, so that at least you can have a comfortable existence. Here at Eat, Live and Be Well, we're hoping that these videos will build you up and help you gain a better understanding of how our bodies work and how we can maintain optimum health. Please feel free, reach out to us, give us a call, drop us an email, contact us, like our Facebook page, subscribe to this channel, and we'll continue educating you. My name is Dr. Dennis Nturibi, and this is Eat, Live and Be Well.